I'm Guyana Sarkisians. I'm from Far Rockaway, New York, and I'm a personal trainer, and I'm currently 34 weeks pregnant.
My name is Rafaela. I live in Queens, New York, and I'm 17 and a half weeks pregnant.
My name is Evie Wilson. I live in Macon, Georgia. I'm a professor at Mercer who teaches journalism, and I am 36 weeks pregnant. So I'm a little under a month away from my due date.
As soon as the outbreak started, I completely stopped working because as a personal trainer, I was going to everyone's homes, dealing with people one-on-one, touching them.
If I even go outside to pick up the mail, I actually spray it with disinfectant before I bring it in the house, just being paranoid.
I try to stay 6 feet away from people, but it's difficult because not everybody else does that. So when you're waiting in line at a grocery store, everyone's like getting closer and closer to you, and it still feels socially awkward to ask someone to scoot back.
I live right on the beach, so I only walk on the boardwalk. And when I do so, I wear a mask, I wear gloves, my head, ears, everything is protected.
I have been bringing Clorox wipes. So I'll put a bunch of Clorox wipes in a Ziploc bag and I'll use it to wipe down my shopping cart. And then I'll use one of them to open up all of the refrigerators at the grocery store. And then when I get back to my car, I wipe everything down.
As far as medical care goes, I'm seeing my doctor every 2 weeks. However, he did cancel our latest appointment, which is supposed to be tomorrow. He wants to now just kind of see me every 3 weeks. He's just trying to have me avoid going to unnecessary appointments, which is just a quick ultrasound check. So he said I can just do it myself, monitor the baby for like an hour, just lay down and count how many movements there are within the hour.
In the beginning, when I got really nervous, my doctor let me skip a doctor's appointment and just call in to see if anything was wrong. But I think my doctor's office is they're taking more precautions now. So I got to go to the doctor, my OBGYN on Monday. I think because I'm so close, I'm supposed to go every week now. So I don't know if I will go every week or if I'll have to go every other week. I had always planned to just have it at the hospital. I'm not a very holistic person. And so I never thought of having a doula or doing it at home.
We're not even sure what hospital we're going to be at, and hopefully everything will be done with the whole coronavirus situation. So it won't be a situation where I have to be by myself.
It was really scary in the beginning, I think, when everyone was determining what was going to happen with the hospitals.
You rely on your partner, first of all, to be your eyes and ears, because if you're under, you don't know what's really going on. Like, I've had 2 C-sections. The first one, I was completely under. The second one, I was actually awake, so I was able to see, but not really do much. And your partner has to make sure, hey, is the baby okay? Am I okay? So it's kind of scary knowing that you by yourself, who can you rely on?
This is my first pregnancy. Personally, the support is really necessary, especially I'm practicing hypnobirthing, where I'm going to be giving birth with absolutely no medication. And it's just strictly using your breath to get your baby out, and you need the support. Thank God, recently our governor has passed the law that a woman is allowed to have any partner with her as long as he is tested negative. However, if things tend to change, I am starting to look into home birth, just because it's important for me to have my partner with me and I don't want to be alone. I practice meditation every day. I do 30 minutes of just meditation and breathing techniques. And then I do an hour of hypnosis just to kind of envision my birth and envision everything just being really calm and peaceful.
I read the news when I wake up in the morning, but I try really hard to not read anything about the world before I go to bed, because it informs my dreams, and it's been really hard to sleep. I
also try to eliminate an hour a day of absolutely no phone, no technology, no news about the coronavirus.
There's just something really helpful about knowing that you're not alone. I had a breakdown at my doctor's office, and I'm not the only person that happened to. So it's just helpful to talk to other people who are going through it, that have the same anxieties and the same worries. It's just nice to feel like you're not nuts.